Welcome, everybody. My name is Michelle Walker. Hopefully everybody has found their way over to the webinar and hopefully everybody can hear me. Thanks so much for joining today as I get the privilege of sharing a little bit about leadership and the critical role that it plays in workplace suicide prevention. So we will get started here. My name is Michelle Walker and I am the Vice President of Finance and Administration at SSC Underground. We're a utility contracting company based in Phoenix, Arizona. And I'm here today primarily though as my role as the chairman of the Construction Alliance for Suicide Prevention. So in my day job, HR is a large part of my function, of my role. And I have been part of the efforts around addressing suicide in construction since 2016, working closely with Sally and with Cal Bayer as the initiatives got started, and then working with the group within the industry to move this forward to address the issue of suicide in construction. So, and I've been part of this workplace group basically since 2016. As I started with the CISP, Cal and Sally got me started with this group back when it was the workplace committee within the National Action Alliance. And so then I've been part of it since we've formed this collaborative partnership to create the workplace suicide prevention guidelines, and working along those in tandem with the efforts specific to the construction industry. And pleased today to kind of bring those all together and talk about leadership and what leadership looks like as a part of this entire strategy. So our goals today through this brief presentation is just to address the topic of what the leadership role is in suicide prevention strategies, looking at it from a high industry level. How do we address this kind of societally and as industries and as workplaces in general? And then what does that look like at the company level and getting the leadership buy-in and participation in order to ensure that suicide prevention efforts are implemented and effective. We'll talk about the importance of leadership buy-in and their public, very public support of suicide prevention as a workplace initiative, and talk about some tools to get leaders engaged and help build the case for them to become engaged in the suicide prevention process. So as we look at the 8 guiding principles for the workplace suicide prevention and how the different aspects that we need to look at to make it a health and safety priority at work, I think leadership participation really covers all of these. It would be critical for any of these to take place, but I think it really comes into play when we talk about the investment required, and making sure that it is a sufficient and comprehensive investment, and also that it is sustained, that it is something that is not just expecting immediate results and then it's gone, but that it's something that's long-term and a part of kind of company operations going forward. And then culture cultivation. And so obviously a big part of suicide prevention in the workplace is creating the culture where those can be protected from suicide by creating connectedness and the health and caring community that looks out for one another. And of course, leaders drive this culture by recognizing and rewarding these values. So I think leadership really comes into play extremely predominantly in those two, but definitely is a part of all of these aspects of suicide prevention at work. And then as we look at the 9 practices for making suicide prevention health and safety priority, leadership, of course, is the one that we're talking about today. And so why is this important? Why does leadership matter as we look at implementing workplace suicide prevention efforts? So as I said, I come at this from a construction perspective, and so I thought we'd just talk about what this looks like as an industry. In 2016, when the CDC released the first study that ranked construction as a top occupational group for suicides, the industry definitely was equipped to pay attention thanks to its culture of safety that really starts at a leadership level. But construction did not always place such a high priority on safety. It happened over the past several decades and only after a key switch took place. Leaders of construction companies saw safety as a business imperative and started requiring action. They started investing in worker safety and later looking at this topic as a comprehensive whole health and safety topic. They started setting safety goals and using the achievement of those goals as an indicator of overall success, both of projects and of individuals. They began to see not just the business and financial justification for committing to safety, but the human need of it too. Their leadership responsibility to ensure that each employee returned home safe and in as good or better condition than when they came to work that day. So just as the shift toward physical health and safety didn't fully happen until company leaders became engaged, the shift toward mental health and safety and protection from suicide risks requires that leadership commitment as well. Leadership impacts every facet of an organization's culture, including the attitudes and behaviors of team members, how teams interact with procedures and rules, as well as the physical work environment. Transformational leadership provides a source of motivation, provides vision and inspiration, and role modeling behavior. Transactional leadership provides social foundation for compliance and sets standards for performance, rewarding and recognizing performance and identifying and correcting problems before they become risks. Both transformational and transactional leadership are required to make this type of cultural shift to create balance between compliance and collaboration. As an industry facing the suicide crisis taking the lives of its employees, the construction industry has taken this on as a leadership topic at the industry and company level. In creating the Construction Industry Alliance for Suicide Prevention and engaging thought leaders in the construction space from associations, unions, safety organizations, a standard has been created, and equally important, resources have been created for construction company leaders to engage with and implement. Leadership comes in many forms, and it is important to focus on all types of leaders at all levels in a target group to ensure maximum impact. So when we look at safety leadership and how it would equate to involving leadership in the workplace suicide prevention efforts, the key principles all line up. Providing safe work environments, uncompromising leadership when it comes to the topic of suicide prevention. In safety, we look at building a culture of safety and building a culture of suicide prevention and a suicide safe environment. Caring for and respecting fellow workers, that fundamental kindness to each other. Having processes and systems in place to ensure everybody is protected. Really creating that cultural transformation, creating the culture that is proven to help prevent suicides and minimize suicide risk, and then educating and empowering. So educating individuals on suicide warning signs, how to intervene, what the steps they need to take are if they feel that somebody's at risk, and then empowering them to be a part of that solution. And then just taking it a step further and just really looking at how some of these things really line up and the tools that have been effective in construction for promoting safety leadership and how they really correlate so well to the suicide prevention leadership that's required. These examples show that all the same principles that have been applied to successfully integrating a safety culture in construction can be integrated for creating a suicide prevention culture in all workplaces. All call for active leadership participation, that real attitude of do as we do, that bold vocal leadership and support, and then provision for resources for effective implementation. So that's the other key component of leadership participation, is ensuring that those leaders who have the decision-making power make that decision to invest in and support all of the suicide prevention efforts. And so when we look at the action steps that leaders can take and that we can take in order to engage leaders, is building that awareness. So using the tools created through this workplace suicide prevention, the study, and the different results from the different focus groups, to educating leaders on why and how the workplace needs to be a part of the suicide prevention efforts. Really empowering that bold leadership, asking them to commit to the investment in suicide prevention, including changing workplace practices that increase risk. So not just saying that they will provide training, but really looking at it from an entire workplace and cultural level and committing to making those changes necessary. Asking leaders to stand up and make a strong statement of the workplace as being a safe place, that there's no tolerance for bullying or discrimination, that there's no, that this isn't an option, that it's required. Helping them, providing them with the resources so that then they can provide training and resources to their employees, making it easy for them to access, having the tools readily at hand to provide them so that they can step up and empower their employees, and then them making that really bold statement, leaders, that it's participation is required by the entire team, that this isn't an optional program, but it's absolutely mandatory. And just like in a safety program, you can't opt out of it. You can't opt out of suicide prevention efforts either. And so what can happen if all of this takes place? I think that the ABC, the Associated Builders and Contractors, they have a STEP safety management program. And I think it sets a really great example for what leadership can do. The STEP program creates an annual safety performance report from all of its participating companies. And it shows clearly that those who have a safety program involvement from the highest level of company management, the C-suite, they experience a 64% reduction in incidents, which is a far greater reduction than companies that do not have that C-suite involvement. In these high-performing firms, the owner or CEO is a direct and active participant in the program. They instill personal accountability throughout the company. They track and annually review goals and objectives. They solicit feedback on the program and they seek ways to improve it. They commit resources in time, money, and personnel, and they integrate it into performance appraisals and other company operations. Each of these steps taken to protect the physical well-being of the workforce can be directly applied to a workplace suicide prevention program as well. What a huge accomplishment it would be to experience these same reductions in suicide rate as they have in physical safety. And so I just thought that was a great story in how a group has really evaluated that involvement, that specific differentiating factor of C-suite involvement, leadership involvement, and how it has that direct impact on reducing incident rates, and how that can be transferred over into our suicide prevention efforts. So this is some of the places that some of this information came from as far as construction and safety and how it might transfer over to suicide prevention. And then next steps, of course, is to take the pledge, get out there in front of companies of all types, in front of their leaders, encourage them to take the pledge to make that leadership commitment, and then demonstrate the resources that are available through the workplace suicide prevention in order for them to implement it in the workplace.